Hey y'all, Dr. Johnson here, your friendly neighborhood medical marijuana doctor. Cannabigerol, the grandmother of cannabinoids, because CBGA, its acid, decarboxylates into THC, CBD, CBG, and CBC, or cannabichromene. CBG is lipophilic, like CBD, which means it's best taken with fat for the highest bioavailability. And the dosing is generally between 10 and 30 milligrams. However, with edibles like gummies, I've seen typically dosing is closer to 1 or 2 milligrams, which is not exactly super effective for the effects that it can cause, which we'll talk about shortly. So, quick caution, nerd alert here. I will be discussing several different receptor families briefly, but I just want to make sure that you understand why exactly CBG works. First, CBG is an antagonist, a weak one of CB1 receptors, and is a very, very weak agonist of CB2 receptors, which is why it is not psychoactive. First, two things CBG does not do. One, appetite stimulation. You can Google CBG and see lots of silly websites that say that it stimulates appetite, but then when you look at the data, there's really only one rat study that gave heroic doses. I'm talking 120 to 140 milligrams per kilogram. And then it did make the rats more hungry. But that is not translatable into humans, and it doesn't really make sense given that CBG is a mild antagonist of the CB1 receptors, which are agonized by THC to stimulate appetite. Second thing, CBG is not anti-nausea, not antiemetic. So CBD agonizes or upregulates once it binds the 5-HT1A serotonin receptors. CBG antagonizes those receptors. This video is getting kind of long, so I will go over the things that CBG does do in part 2 next.